So, me again. We're going to talk a little bit now about postural alignment. Okay. Now, this is critically important, not only for the athletic population we do a fair amount of work with, also it's very, very important for people just for staying healthy. Essentially, the principle is, in the simplest sense, is if you're driving your car and you know that one of your front wheels is pointing that way, if you then drive that for a mileage or drive it particularly fast, it's not going to be good for the structures of the car. Okay? Same applies to our body. It's quite a sensitive piece of kit. It likes its joints and muscles to be positioned correctly. Okay? When we take those joints out of position, it affects the muscles that span the joint either side. That causes some muscles to be longer and having to work in positions where they're not strong, and it shortens and tightens other muscles and makes them upset and annoyed. So there's some things that we can think about. And this example is a little bit more to do with general lower back pain. If you're finding that you're getting tight in your back, this is often what we can talk about as a contributing factor. Back to my dodgy artwork. So if that's your pelvis and you're looking at someone from the side, it's their leg, that's their knee, it's their leg, that's their foot, it's their spine, that's their head, that's the nose, okay, looking that way. So what I've tried to show here is, like I've got on my chap here at the side, we've got the natural curvatures through the spine, we've got our pelvis, and we've got our legs. Now, this is someone that should be well lined up. So if I was to drop a line of gravity, it would naturally go through all of these curves perfectly. Okay? What that means then is that my body is balanced. I'm not going to fall over, which is preferable. Okay? It also means then that the muscles either side of all these joints are balanced. Now, the problem that we see in a lot of our patients when we're working with them, especially those, again, in a category of people with general lower back pain, is that they don't have these good alignments. What we find is instead, this is slightly exaggerated, we end up with this. So a Donald Duck position. So what this means basically is it means that often when we test, the abdominal wall won't work. What we'll see is because we sit down and we do lots of cycling and we run and we do these type of activities, is they're making the muscles down through the front of our hips and legs very, very tight. So I've got very, very tight muscles in the front of my hips, my hip flexors. I've got very, very tight muscles in my quads. What I also find then is because I haven't got my core stability working, but I've got lots of tension below it, it rolls my hips forwards. And we call this an anterior pelvic tilt. Okay? That then, as the pelvis rolls forwards, can force the knee backwards. So it can cause knee problems, feet problems. But what we find here is then this stuff in our lower back, because the hips has rolled forwards, these muscles are short, tight, activated, and they're on all the time. So this can contribute to a lot of the discomfort we can feel in lower back. To complete the series, your bum doesn't work. So again, what we find is in people that have lower back pain, often we find they're dysfunctional in the hip. So the hip saves the lower back. So it's really important that as a course of moving forwards with people, I need to promote hip function. That's my job. Stiff in the middle, movement, and powerful from the hip. We can then address each of these different areas, and people, depending on what kind of situation they've come to us with, will have a variety of these type of characteristics. Physios and I, we can test for this. Okay, I'm able to give you exercises specifically to counteract your core stability. Lower back will take care of itself. We'll stretch the short, tight muscles. We'll activate the muscles that don't work. If I take care of those areas, this will largely take care of itself. So stretching lower back is not always the best route. It's the symptom, so I need to work out a way in which I can deal with the cause of the problem, and that in turn makes this nice and happy. Don't stretch the lower back necessarily if you feel that it's tight. Deal with the cause. That's a little bit on postural alignment.